everybody, and thank you, Dr. Mohanty and organizers of WIROC Global for giving me this chance. Now, the discussion here is whether we should aim for an anatomical hip center in a hip arthroplasty done for a type 3 Crowe DDH. Dr. Swapnil very eloquently mentioned what Crowe type 3 was. So it is somewhere in between 2 and 4, 4 being completely dislocated and grade 3 being about 75%. Nowadays, the Hartov-Filakidis classification is also being used in that category. That type would be type B, i.e. a low dislocation. So what does a Crowe type 3 dysplastic hip entail? The acetabulum specifically is a superior lateral deficiency. The medial wall is on the thinner side. The anterior and posterior walls are quite intact. When somebody says high hip center, we say a superior position of the cup. But there have been unacceptable rates of loosening. So therefore, my plea to all is, if possible, restore the hip center, i.e. the true acetabulum. A medial and an inferior location does facilitate good sort of limb lengthening and good incorporation of bone. So what is the goal of the total hip arthroplasty? It's to restore the anatomical hip center, which can be achieved in hips with DDH by placing the cup at the level of the native acetabulum. The criteria is that you should have 70% host bone contact at the time of your surgery, and you should not be relying on the femoral head graft as a primary support mechanism. Literature does back this, and we'll just see a few papers. This was the latest review in the CORR May 21, which says that in studies which were conducted as a meta-analysis, those studies which had the high hip center compared to an anatomical hip center, there was a higher loosening rate, a revision incidence because of that, and there was also a higher incidence of dislocation in the post-operative period. This study from the Mayo Clinic in 1998 very clearly states that those cases wherein the acetabulum was outside the anatomical region, they had a very high rate of cup loosening. And superior or laterally placed acetabuli also have the same problem. So they also recommended that to place the hip at the anatomical center as much as possible. Other papers are alluding to the same fact. In this paper, it was clear that if you are doing a high hip center, then you are compromising acetabular bone stock. And since these patients, that is, our patient is only 32, so we should aim for an anatomical center, because if you go for a high hip center in this, your bone stock for future revisions is compromised. Similarly, if the hip center was more than 1 centimeter superior and more than 1 centimeter lateral to the approximate femoral head, there's a higher incidence of loosening and cup revision. So these are all peer-reviewed journal papers supporting this problem. And there is, of course, a decreased range of movement as well, but that can be argued that that can be compensated over a period of time. The recovery of the abductor muscles is also delayed when you have a high hip center with the risk of instability. So these factors are all to be kept in mind when we do a positioning of the acetabular cup. I'll just show a few examples what I exactly mean by a hip center to be in the anatomical region. Here, if you see, the cup is medialized and elevated, but it is in the anatomical center and not in the false acetabulum. Or in these couple of cases, you can choose any method of reconstruction of the acetabulum. As long as you are at the center, you should have a good result.
Can you please wind up?
This last slide, this patient in question is not a conventional DDH patient. So it's a patient who has a spastic CP with muscle imbalance. Acetabulum morphology is similar to the one in Crowe type 2 and 3. But here, if you see, the teardrop is relatively well developed. So the hip was probably well seated and has migrated due to soft tissue imbalance. So in this, I definitely feel the acetabular socket should be in the anatomical center with the restoration of the medial, with the socket medialized, and the CT scan also shows adequate bone stock in the anatomical area to get that result. Thanks very much.
Thank you.